Good morning, Dr. Patino here at the Cosmetic Surgery We're going to do power-assisted liposuction. The cannula that vibrates, it's like a toothbrush, electric toothbrush. And we're going to see what we do here. So we're going to do power-assisted liposuction to the inframammary, upper abdomen, lower abdomen, the flanks and the hips, and an ultrasound guided gluteal fat transfer. So what I want you to see is what comes out of here, and whatever comes out of here is what's going to go into her bottom. So if you see bloody output is going to go into the bottom. So if you see yellow, beautiful fat without a speck of blood, that's what's going to go into her bottom. So what do you see there?
We see the yellow fat with no speck of blood.
Great, and we have a visiting nurse here. Kimberly, how are you doing, Kimberly?
Fine, thank you.
Great. So you've done many of these cases with famous doctors. I know some of the doctors that you work with in Beverly Hills. What do you think about this output that you see?
I mean, it's the perfect outfit that you want to see. You want to see that bright golden color without any pink in it. It needs this pure, clean fat. So this is exactly what you want to see when you're looking for a liposuction fat transfer BBL.
Thank you. Kimberly, now what do you see that I do on the liposuction part that is different from what you've seen other doctors do?
Well, I do see that you let the tumescent absorb for the adequate amount of time so you get that maximum penetration, so you get optimal results when you're doing the lipo.
Wow.
And
so
when you hold the cannula, you're making sure it's at the surface level. You're using your other hand to counterweight so that you know you're in the right area when you're doing the lipo. You're in that subcutaneous area where you want to withdraw all the fat.
wow, that's very good. So what about the speed of my stroke?
So it's a good consistent speed where you're being careful not to bruise or cause any harm or striation during the lipo, so you're not so that post-op recovery, you have a smoother look when you're recovering.
My stroke's faster or slower than the other doctors you've seen do this?
It's not really about speed as technique, right? We don't want to injure the skin, injure the muscle, or make sure we want to make sure we're in the right area. So good consistent speed, you're actually at a rate that's kind of faster, which is good at the same time because less time in the area, less trauma.
My career power-assisted liposuction. Notice that my strokes are, I would say, much slower than most doctors, and less trauma to the tissues, and a very nice output as a result of that. Thank you. So this beautiful bloodless yellow aspirated consisting of pure fat is obtained by multiple tins. Number one tin is what the patient does. So we instruct all our patients not to take any aspirin-like medications, vitamins, herbs of any kind for 2 weeks before and 2 weeks after the procedure. Number two, the tumescent anesthesia that we use has epinephrine in it, and it clamps down the blood vessels. Number three, and probably most important, we wait a good hour before we start the procedure after we put the tumescent anesthesia, so the epinephrine has time to act and vasoconstrict the blood vessels so that there is maximum vasoconstriction and minimal bleeding. Number four, my strokes are very slow and they're very calculated. This not only gives you this beautiful output, but also decreases the risk of intra-abdominal organ perforation, or if you're in the thoracic cavity, intrathoracic perforation, something that has never happened to us. And when those things happen, it happens because the surgeon inadvertently gives an unintended stroke. It's like when you're driving too fast and you lose control of the vehicle goes somewhere where you don't want to go. Same thing happens here. So my strokes are very calculated, very slow, and much less risk of injuring internal organs. In addition to that, there is less fatigue for the surgeon because the surgeon is comfortably doing the procedure at low speed. Yet very efficient because we don't have to process this fat in any way. This is the pure fat that's going to go into her buttocks. Less trauma to the tissues, less trauma to the fat cell itself. So there's going to be less risk of rupturing the fat cell and leaking of oil. The oil can enter the buttock area and the body rejects it and creates a capsule around it, and those are the famous oil cysts that we never had in our practice. There could also be dead fat cells, and the body does the same, encapsulates it, it creates a capsule around it. Or there could be blood, and the body does the same thing. It's similar to if there is glass. You cut yourself with glass, the body's going to create a capsule around the foreign body and try to push it out. It's the same thing that happens with the breast implant. When you have blood around the breast implant, the body rejects it and creates a capsule around it. That's the famous capsular contracture, which also we rarely have because of the transumbilical approach and also because of this special technique, right?
Yes.
Thank you. And I believe that the famous blowout fractures that happen in the buttocks when you do a fat grafting to the buttocks, something that we never had, also is the result of the body encapsulating blood or dead fat cells or oil and pushing it out, and so it forms like an like a pouch that sticks out of the buttock. And so I believe that how you collect the fat is very important, and how careful you are with the fat graft. And you'll see when we inject this fat that it's going to be this very yellow, beautiful fat that we are obtaining now here is the same fat that's going to go into her body. Thank you. So notice how we're still getting a very nice fat, and the infranatant is just lightly pink. I'm going to let it go and you'll see how the fat goes in there. So this fat is only collected in 500 ml of normal saline, and we don't process the fat at all. This is what's going to go into her body. Thank you. This is my non-dominant hand, and even for those surgeons that are not ambidextrous, you can do this because the strokes are very slow, very calculated, and so it gives you also an advantage for the surgeon. Less risk of repetitive injuries like tendinitis because you're using both hands, both arms, so less risk of tennis elbow, which is common with liposuction, tendinitis at the shoulder level, and even carpal tunnel syndrome. So for the surgeon, it's also advantageous to do this procedure. And again, you can try, if you're not ambidextrous, which, you know, most surgeons are ambidextrous, but if you're not, I know some surgeons that are not, then you can try it, and it's less risk for the patient if you do it slowly, right? If you go very fast, no, that I would not recommend that, especially if you're not skilled at it. But slow, you go at the right level, and it's easy to do, and less fatigue on the surgeon, and less risk for the surgeon as well. Thank you. Okay, so this is ultrasound guided gluteal fat transfer. Look at that fat graft. Wow, what color is that fat graft?
Yellow.
This is just incredible. So this is the fat that we collected, and it has not been treated in any way. This fat graft was collected on 500 ml of normal saline, and is being placed in the subcutaneous space under ultrasound guidance. Thank you.
All right, so now we are transferring the fat into the butt, and here on the ultrasound, it is the skin. This is the superficial gluteal fascia, and then Dr. Patino's cannula is right here, and he's wiggling it. And then below is the deep gluteal fascia here, and then the striated muscles. So he's very far away when he puts the fat into the butt.
Okay, now look at the tip of the cannula right there.
Right here.
And now I'm going to give it a bolus.
So it's a cloudy gray area here, and it's pushing the muscle and the deep gluteal fascia down as he puts the fat into the area.
Thank you. Okay, so you can see the cannula here. I'm going to wiggle it a little bit, right? You can show it to them.
Right there is the cannula.
Very good. And show them the superficial gluteal fascia.
That is right here.
Okay, and the deep gluteal fascia.
That would be right here.
And the striated muscle.
It is this down here below it.
And that's where we don't want to put the fat in there, because the fat can go into the superior or inferior gluteal vein and gets absorbed into the systemic circulation, and could be fatal. Thanks to God, we never had anybody die. We want to keep it that way, but this is the safest way to do it, under ultrasound instead of blind, because a blind procedure, you know, the doctor, no matter how much experience they have, either intentionally or unintentionally, accidentally, they can put the fat into the wrong place. And so this is why we're advocating this through the World Association of Gluteal Surgeons, which, by the way, we're going to have a meeting next week in Miami with Dr. Miami and many famous surgeons. Dr. Del Vecchio going to be there, and many famous doctors throughout the world from 35 different countries. Thank you. So I'm withdrawing the cannula a little bit. Why don't you point to the tip, and again, I'm going to give it a bolus. Okay, you'll see that gray stuff that's entering the area, and how the deep gluteal fascia gets pushed down, and the superficial gluteal fascia gets pushed up as fat enters the space.